been a crazy couple of years, and at the forefront of everybody's mind has been COVID. And you've probably put a lot of your other health concerns on the back burner. Well, we want to make sure that you're not doing that. So I want to bring in Dr. Christopher Valentine. He is with Optimum Care Utah. Hi, Dr. Christopher. How are you?
Hi, how are you?
Great. Thanks for coming on the show, because I know that, we've talked about this before, but so many people have not been going to the doctor either because, they just kind of brushed it aside or they haven't been out much, right? So how do we make sure we stay healthy?
Right. Well, it's really it's been interesting because the pandemic has really created a sort of silent pandemic amongst chronic diseases because of a lot of concerns people have about COVID exposure, going to the doctor's office. It just has gotten put off, and we've seen an increase in complications because people have not had a lot of that preventative care.
Yeah, and that's what we want to focus on, is the preventative care. So let's talk, what is Optum Care and your partnership with the American Heart Association?
Well, Optum Care Utah is a what we call a care delivery organization. Basically, our role is to serve as a sort of intermediary with the insurance company in order to ensure that patients are getting evidence-based care, that they're getting all of the right kind of care, that we're doing a lot more of this sort of proactive outreach in order to really help to eliminate the barriers that patients often have in order to get the care that they need. So we really work with your primary care physician in order to ensure that you're getting what you need.
Great. And then, of course, you guys like to work with the American Heart Association to really encourage people to be heart healthy.
That's right. That's right. We partnered with the American Heart Association because we have a lot of the same goals. We are able to leverage a lot of the relationships that we have with our physicians and with our patients in order to ensure that they are getting the right kind of evidence-based treatments in order to reduce their risk for heart attack and for stroke.
Right. And those two things, that's what we really want to focus on, is heart attack and stroke, and making sure that you're doing the preventative care, but you're also taking care of yourself as well with exercise and eating well, all of that.
Yes, no, absolutely. And that's been another thing during the pandemic. I think, we've developed, maybe some of us more than others, some bad habits, maybe kind of tapering off on our exercise, maybe indulging a little bit more in less healthy habits, shall we say, in terms of our diet and whatnot, in addition to not necessarily seeing our physicians as frequently as we would have before. And so the pandemic has kind of had all of these sort of secondary effects. And although people are right to be concerned about staying safe and not being exposed, as a result, there are a lot of unintended consequences of the isolation that's happened. And those consequences are turning into some real complications.
And that's where we need to get people going back to the doctor's office. I mean, there might be some cases where they really, need to be careful. And you guys are all very aware of that and understanding. And that's why you're trying to help these different patients so that they can get to the doctor in the right way, whether it's virtual or in person.
That's right. That's right. And I would say that compared to a year and a half ago, when everybody was new at this and we were just scrambling to figure out how we were going to be able to take care of patients, really, your doctor's offices have really learned how to live in this virtual environment. I mean, like all of us, like you and I are right here today on our interview, physicians have these same kinds of platforms available. So if you're not able to go in for an in-person visit, or you don't really feel comfortable yet, I'd say that this is kind of one of the silver linings that's come out of the pandemic, is it's really forced us to adopt some of these technologies. And it's very likely that your physician has these technologies available so that you can have a good face-to-face visit with them.
Yes, absolutely. Well, if they do want more information from the American Heart Association, just a reminder of how to be healthy and those kind of things, as well as your website, give those to us.
Sure. If you want to learn more about things that you can do in order to stay heart healthy, in order to reduce your risk of other cardiovascular disease, including stroke, go to heart.org for information from the American Heart Association. And in there, you can actually search under Utah for any local resources or activities. And then as far as our organization is concerned, we are optumcare.com. And that should take you to the Optum Care Network Utah website as well for more information about what we do.
Fantastic. Well, Dr. Valentine, thank you so much. And I'm glad that we're able to do this virtually. Like you said, it is the silver lining. So
that's right.
Thanks for being here.
For your time.
And here are some symptoms of heart attacks to watch for: chest discomfort or discomfort in the arms, back, neck, jaw, or stomach, a cold sweat, nausea, and vomiting or lightheadedness. Now, in a stroke, you'll want to remember the acronym FAST: face drooping, arm weakness, speech difficulty, and T for time. It's time to call 911.